Hello, everyone. Today I wanted to share an example of a patient of mine with a history of SIBO, intestinal permeability, leaky gut, constipation, hypothyroid, and a long history of multiple food intolerances and the results of her most recent labs. Been working with this patient for a few years now. She had one of the most intense cases of SIBO that I've ever worked with. We did herbal remedies at first, and we did that for several months with little change, and finally had to refer her out to a primary care doctor who then referred her to a gastroenterologist because the primary care didn't believe that SIBO was even a thing. And the gastroenterologist then had her do some breath testing to see if she did indeed have SIBO, and the results came back so high for methane-dominant SIBO that the lab couldn't even measure it. So she had to go on a prescription antibiotic, Xifaxan and neomycin, and she reported to me that she had the absolute craziest bowel movements ever after doing that and could tell that there had been things stuck in her system for decades based on some of the things that came out. And it took a few months after that for us to rebuild up her microbiome, most notably with a probiotic called VSL number 3, which is one that I give to some people with IBS, or in some of my clients with inflammatory bowel disease, Crohn's and colitis. That can be very helpful. And she actually makes her own homemade yogurt with that now. And in a single scoop of this homemade yogurt that is fermented for over 24 hours so that there's no more lactose in it, there's something like 90 to 100 billion CFUs of probiotics in a single cup of this yogurt. And that really keeps her regular. And her thyroid function started to slowly normalize. And then her periods started to slowly normalize and regulate. And then she and her husband were able to finally have a baby, which was very cool because for a long time they thought that that wasn't going to be a possibility. So I saw this patient again recently, and she wanted to do some follow-up testing because she hadn't been evaluated for these things in a while. So Cyrex has a nice bundle of several panels together, one to check for intestinal permeability, leaky gut, one that helps to check for blood-brain barrier permeability, leaky brain, because when you have leaky gut, there's a higher chance you can have leaky brain, as well as for signs that you have irritable bowel or SIBO. So overall, her results were quite good. The intestinal permeability screen showed that actomycin, which is present in muscle tissue, the smooth muscles of the gut, was fine. Occludin, zonulin, these are proteins that are in between the tight, watertight junctions of the lining of the gut. And when they are activated and there's higher levels of zonulin or occludin, or the body's reacting to them, generally speaking, you have higher levels of leaky gut intestinal permeability. They also test for lipopolysaccharides. This is what we call an endotoxin present on a lot of gram-negative bacteria. Those are really common types of bacteria found in the human gut, like E. coli, but the immune system can recognize them. So if you have leaky gut and those E. coli microbes are getting through the lining of the intestine where they're exposed to the immune system, then those lipopolysaccharides, the endotoxins on the bacteria, which is it's a little protein on the membrane of the bacteria that the immune system recognizes. When it gets back there, that creates inflammation. And then additionally, if you have intestinal permeability, those endotoxins from the gram-negative bacteria can hitch a ride on dietary fats and get into your lymph or get into your bloodstream where they become systemic and create inflammation all throughout the body, even to the brain, which is why if you have leaky gut, it's a much higher risk that you have leaky brain. And you can see in this individual, the blood-brain barrier protein antigen is active. So even though her intestinal permeability is kind of equivocal, it could be that she has intestinal permeability, it could be not. This is basically between 1 and 2 standard deviations over the mean, and this is greater than 2. So when it's greater than 2, it's really obvious. The higher these are, the equivocals, especially if they're really close to the reference range, the greater chance that that's also positive as well. So we know that this individual has um, some antigen activation to a blood-brain barrier protein. So it's possible this person has leaky brain. The reason they test different antigens here is because the body has different responses at different times. IgM, this is the general antibody the immune system creates in response to any sort of threat right away. Boom, it's just like a first pass to try and see what's going to stick, literally, to the antigen, the microbe, whatever it is that's causing an insult or an injury to the body. Then, as the immune system figures out what threat it's dealing with over a period of days and switches from the, what do you call it? Golly, forgetting the word, but it switches to the adaptive immune response from just a general immune response. Then you get these antibodies that are more specific. IgA, which is found in the mucosal linings of the body, like the gut, in the mouth, sinuses, genital areas, anywhere where there's a mucus secretion. And IgG, which is found systemically, so like infections that are in the blood. Like if you get a cut and then bacteria get into the bloodstream, they will produce IgG to fight those off. So IgM indicates like a first pass response, and then if it specializes, boom, IgG or IgA, then we know it's more specific. So it's possible that in general, there's just some inflammation, but it hasn't yet created a leaky brain. You want to correlate these results with what the patient's experiencing. And this person doesn't seem to have any issues with depression, anxiety, periods of feeling intense fatigue that don't let up, etc. Especially because their intestinal permeability screen came back relatively fine. You have the general response to endotoxins from microbes in the gut. That's starting to produce a little more inflammation than we'd expect, um, as well as to the occludin zonulin. Maybe she just recently had some meals that were high in gluten, which can release more occludin zonulin, and her immune system was more reactive to that at the time. Then you have the irritable bowel SIBO screen down here. This checks for a variety of things that are found in people with an irritated or inflamed gut lining, as well as increased exposure to bacteria where they shouldn't be. As we get down the digestive tract from the relatively sterile stomach into the small bowel, there'll be some microbes, but this is the most common place for certain types of bacteria that produce hydrogen or methane to overgrow. And that's where a lot of people can experience gas, bloating, constipation, or diarrhea, depending on which microbes are overgrown. Then you get past the ileocecal valve, which is a valve between your small and large bowel that's down on the right-hand side of your abdomen near your appendix, and that leads into the large bowel, the colon, and that's where there are lots and lots of microbes. It goes from the relatively sterile small bowel to the mega city population of microbes found in the colon. So bacterial cytotoxins, um, checking to see if there's, an immune response to bacteria in general. And we sort of have a general response, but nothing too specific. That seems fine. And cytoskeletal proteins to see if there's also some involvement with the gut lining here, and that also seems more general. So while we do have a bit of an inflamed response here to the brain, overall, this person looks really good. So I'm going to have them continue to work on having their regular high dose probiotics with yogurt because it keeps them very regular. We may focus on avoiding some more of the inflammatory processed foods for now, just to kind of calm this response down. And then in terms of other things we recommend, increasing foods that are high in omega-3s, like cold water fish, sardines, anchovies, salmon, because they're anti-inflammatory, those omega-3s, and very helpful for brain health. Um, Half of the fat in the human brain is omega-3s. So algae oil, if you're a vegan vegetarian, or fish oil from cold water fish can be very helpful for that, as well as some other anti-inflammatories that we'd want to focus on, like curcumin from turmeric, resveratrol from red grapes, or boswellia from frankincense. All right, I hope this was helpful and that you learned something.